So we decided to partner up and build a relationship with the Genesis people once we realized this product was exactly what we needed. And we made what we call the CBP suite. So a lot of times people are wanting to practice and utilize the systems and the procedures and integrate and create some of the things that we've created here. And what we've done is we've made this piece inside Genesis that people can utilize, and I'm going to tell you a little bit about what we built inside of it. The tractions. Some people don't know how to document the tractions and all the different types of tractions and how to put that into their note system. So all the different CBP traction positions that are possible we've put into the suite, so you could just click that button. The nice thing about it is on the note system that they have in there, it retains that data. So unless you change up that traction, you're not having to remember it every single time. It's there for the provider. And also the postures. You know, patients come in with a posture, and if they have a hip rotation or they have a low shoulder, you know, that's their posture, and that's going to be there until you help improve that patient's posture. And that type of data stays there. We quit using travel cards that used to follow the patient around the room, all this paper. It's not HIPAA compliant. People can see patients' data, etc. And then we worked with Genesis to figure out how can we utilize the traction information within the program. And you can go to any screen in this 5,000 square foot facility and hover over the name of the patient, and you can see what traction that they're supposed to be doing for that day. It says where they began, where they're at, and we also have their goals in there, so that the team is constantly, at the click of a finger, or just I should say a hover, because they're just hovering over the name, they could actually tell the patient, this is your goal. Remember, your goal in traction is to get to the front weight to be 15 pounds, and they could be discussing the importance of that goal, and they don't have to go dig inside the system or go pull a chart or go dig for a travel card or anything like that. Within the suite as well, we have we built all of our medical weight loss. People were like, how are you doing weight loss? How are you documenting that? Etc. We built all the necessary documentation that is needed to create that SOAP note. The different phases that we have within the program. Everything that's in there to become compliant with the notes as far as Medicare and having a registered dietitian and dealing with obesity, which is something new that Medicare now pays for, is within that system. And they're allowed 22 visits per calendar year to assist that patient in weight loss, and it is covered by Medicare. Once again, a lot of commercial insurances are now paying for a registered dietitian to also take care of those patients. Well, all of that documentation piece, how to do it, what we're doing, it's in there. Jason and I spent weeks creating all those notes, and we're continuously changing them. We even have the spreadsheet when the patient comes in, how many inches they've lost, you know, from the abdomen area to the hip area to their thighs to their arms. You place that data in there and it calculates it out. The patient leaves with it every day. Down below it has the goals, so the patient's reminded of what goal they set forth. It also tells them how far away they are from their goal, and that's what we call an X-Docs, and that's available in there. X-Docs is just another feature of Genesis. They have tons of forms that are available to use. We created ones that were CBP friendly. One that, not just CBP friendly, but friendly for an integrated medical office that we have here. They're all within there. So we even do knee injections. We inject hyaluronic acid to help people prevent knee surgery. They're riding bone on bone or almost, and we want to prevent that journey from ever becoming their reality. All that documentation, we've created notes on that, and they're within this system. We've also created validations, and a lot of people are like, what's a validation? Well, how many times do you guys bill something and then you realize we did that completely wrong, we were not compliant, we did not follow the rules of that particular carrier, etc., and then there's nothing you can do because it's done. What's done is done. It's over. You can't go back and change what's already been created. So validations are almost like red flags, warnings that pop up and let you know on many different parts of the program. The providers get pop-ups, little notifications, and it's so nice. If they say, oh, I didn't see that, the provider can't even tell me, and I have so many different providers in this building. I have chiropractors, physical therapy, functional therapist, nurse practitioner, medical assistant, my medical doctor. I mean, there's so many people, the registered dietitian, there's so many people accessing the documentation system that if that button turns red, it's like red, it's like a stop sign. Don't press it because there's something wrong within your note or within your coding, within your billing, and it's giving them a warning. It's like a cleaning the claim before it goes out dirty. And that's what a validation is. And since we've been working with this relationship with Genesis, we've created so many that I lost track. From if you're going to provide this CPT code and it doesn't have one of these ICD-9s, therefore it's not medically necessary. So the providers know if this is your diagnosis code, you can't provide this service because there's no medical necessity. And we have rules that are placed inside the system to flag and notify everybody and let them know that there is a inconsistent diagnosis, or that it's time for an evaluation and management code. 12 visits have gone by and you've not done that yet. It will warn the provider to make them aware of what they need to do. In addition to that, there's the rules of how you're supposed to code for Medicare, how you're supposed to, one of the newest validations that we've done is the way auto insurances now want to see the ICD-9s. So they want it seen differently than even Medicare sees it. Well, the providers can often get confused when they're out there trying to treat the patient and be with the patient, and all these logistics can definitely get lost, errors can be made. But the Genesis system in the CBP suite with all of these tools that we've created make that life very simplistic. And we put in a lot of work. It's been a journey for the last 7 months of working every single day with their team, our team, and Dr. Deed Harrison's team out in Boise. And together we have created something spectacular. And it's amazing. It's very, very affordable. It's only $150. When I was using Doc Plus, I used to have to buy all the notes, and I was spending anywhere from $700 to $1,000 sometimes inside of a month buying forms. So to know that a doctor only has to spend $150 a month to utilize this suite, and the beauty of the suite is, if everyone knows me, the suite will be endless. We will constantly be working on it, adding more things, making it more robust than it already is. So it's a wonderful package. We wanted to make sure that doctors could utilize it. So we really, really marked it at a very, very affordable rate. So we're excited, and we're ready for you guys to start using it.